you said, like you start moving, you start stretching, you start warming up, tissue temperature goes up, and all of a sudden you don't feel as stiff, you don't feel as restricted, you don't feel as though your tissue doesn't have the ability to be compliant.
Yes.
And I think this is the same thing that the same feeling particularly that people get when they've had manual therapy. Even if it's a short intervention, as you said, like people will get up off the table or however it's been applied, and straight away they'll actually say, oh, that actually feels like it's moving better. That feels better. I'm actually getting better feedback from that tissue.
Well, and using this example, I think this highlights too where we need to differentiate manual therapy based on type and intensity and so on, because if we just do more general low intensity manual therapy, which I use a lot, particularly say in the context of say a rehab session, someone comes in, restricted movement, do some manual therapy to create a window for them to be able to apply load through a larger range of movement. But that the effect of that manual therapy may only be short-lived, as opposed to if we start to do more concentrated friction at a higher intensity, you're going to create more of a hormetic response. So that primary response might be like, geez, that hurts. You might create a bit of localized inflammation, but then that creates a cascade of a physiological response where you get changes in the extracellular matrix, and then 3, 5, 7 days later, all of a sudden, the benefit of that effect is long lasting. All of a sudden, it's like, actually, my range of movement's improved, I see a reduction in pain, and it sticks. And again, like we've talked about this before, but it's similar to, say, exercise, where if you apply a low magnitude stressor, it may create a acute improvement, but it's typically going to be transient in nature. So this comes back to thinking of, well, what effects are we trying to elicit here? And, we've talked about this before, but thinking about, say, manual therapy that you apply prior to training or prior to a rehab session, you're not going to get them on the bed and try and break them. You're thinking about what are the actual effects I'm trying to do here.
Well, and I think that's the key thing that is important. There's in my mind, at least, even from a really basic clinical perspective, there's two types of manual therapy that you're doing. One is to try and address some of these tissue changes, and basically a lot of times is to mitigate pain responses. The second type is, as you said, this performance type of manual therapy, and they may actually be related. So someone might come to you for improving performance and saying, I'm actually being limited by pain. But there's even times where someone doesn't have pain and you actually are just assessing and looking and saying, okay, I think that we can get a little bit more range out of your hip or a little bit more range through your ankle or whatever it is by applying some manual therapy to start changing this local tissue environment. Yep. And those, I think, are slightly different. I think it's really important that part of the discussion that you always have about manual therapy and whether it's effective or not is related to pain. And for us, as you said, we've probably discussed this a million times, but there's always two parts of all the processes that you need to go through or be thinking about when you've got someone present to you. And the first one is, okay, is pain a major factor that's actually going to alter what I'm going to do to try and, to make changes that stop this injury from occurring again and to rehabilitate them back to the level of activity that they need. And the second thing is, obviously you need to address those underlying factors that are going to either remove that pain presentation. So as you suggested before, potentially things around like the inflammatory status of the individual, and even the actual local tissue characteristics. And also, ultimately you're going to try and improve those things to the point where one of the symptoms they don't get is pain.
Yeah. And it's